So what are some of the symptoms of a thyroid problem? You brought some great visuals so people at home can get an idea.
So this little model actually represents the volume of just 1 pound of fat.
So that's a pound of fat?
This is a pound of fat. So for the individual who has tried diet and exercise, especially I know I'm sitting down with a thyroid patient when they tell me I'm eating a low-calorie diet, I'm eating nothing but salads, I'm working out for an hour 5 days a week, and I'm actually gaining weight or losing just
a tad bit,
ounces at a time. So stubborn weight gain is one of the first symptoms of a thyroid problem. The next one is people who feel tired, sluggish, they require excessive amounts of sleep to function. Maybe they are,
depending on energy drinks,
energy drinks, caffeine, these types of things. This person is using these stimulants to take the place of what their thyroid is no longer doing, which is producing and supplying energy.
Trying to stimulate,
for the body. This one right here, I know is kind of scary to look at here, but this is it's really
very visual.
Yeah, this is a serious problem for thyroid patients, especially advanced stages. Hair loss. People with thyroid problems will have a tendency to lose hair in places they don't want to lose it, especially if you notice that you're losing hair around your eyebrows. That's a classic sign of a thyroid problem. Okay.
And who does the thyroid problem exist in generally? Is it more women compared to men? Is there a certain age group?
Yes, it is predominantly women. Men can suffer from thyroid problems, but it's definitely more common in women, especially as you reach, your mid-30s and then moving on, on.
Which is, you might have been fine up until your 30s, and then you see you're starting to fall under these categories, or you're seeing these symptoms that you just talked about.
A lot of things can just flip the switch, and all of a sudden you start noticing the weight gain and the hair loss and so on. Okay, so now we're looking at morning headaches. So individuals that require painkillers, especially if the headaches are in the morning and then they go away. Digestive issues as well. So we're looking at some antacids and things like that. Bouts of constipation, diarrhea, unpredictable reactions to foods. Also acid reflux and things like that. And then the last one we have over here is also thyroid. People with thyroid problems will oftentimes suffer from depression, insomnia, brain fog. They just can't seem to think clearly. And so you notice that over time, what happens is in traditional medicine, they'll run a simple blood test, and if that test looks off, they'll give the person thyroid hormones. Unfortunately, in the vast majority of cases, those individuals will still continue to suffer with these symptoms. So then they start medicating for each individual one. So for individuals that have either been told they don't have a thyroid problem because the labs look normal, I'm telling you, if you have these symptoms, the correct labs just simply haven't been ordered. They haven't addressed it. If you've been told you have a thyroid problem and you're put on hormones and yet you still continue to suffer with these symptoms, the underlying problem hasn't been addressed.
And then here's the information on Inspire Wellness Center. There's their address. You can actually give them a call and visit their website as well. It's always interesting with what you bring, especially with the visualization, so people can get an idea. And thyroid, sometimes people don't like to talk about it because of the weight issue. But it's an issue that needs to be talked about, especially if you're suffering from it. Find out what's going on.
Absolutely.
Thank you, sir.
Thank you.
Have a good day.